Good morning, everyone. Welcome to the San Mateo Dental Society meeting. My name is Dr. Pinal Veeraparia. I'm the president for 2023. Before we get started, I want to review how we will be running this meeting. All participants will be placed on mute. Today's presenter will provide information about long-term care. During the presentation, you may post a question into the chat box. Our staff will review the questions and we will go over them at the end of the presentation. Feel free to post your questions throughout the presentation. If you have any questions, any other questions, please post them as well. So let's get started. Today's presenter is Michael Wong, DDS. He's a San Francisco native who graduated from UOP Dental School in 1994, but retired early due to a back injury. Since 2015, he has specialized in life and long-term care planning. Having taken care of both of his parents for 13 years, he fully understands what families go through every day when it comes to long-term care. Michael lives in Belmont with his wife and 2 teenage children who have discovered how to press his buttons on a daily basis, just like all of our kids do, right? He enjoys watching his children's sport teams and volunteering for Son Research Dental Health in San Mateo. Please welcome Dr. Michael Wong. With that, I will give it to Dr. Wong to start the presentation. Thank you.
Oh, thank you, and good morning. Thanks for joining us on this Saturday morning. So today's title is Navigating the Long-Term Care Maze. A lot of times we hear from friends and family about caring for a loved one, how hard it is, what can you do about it? So today I hope to kind of shed some light on how to navigate that with your family. So a little bit about me. I went to UOP for dental school, graduated in 1994. Car accident kind of changed my career. So for the past 8 years, I've been helping people with life insurance and long-term care. With our group, Long-Term Care Pacific, we actually are partners with over 650 alumni associations and professional associations. So basically, all University of California's, all Cal States, UOP Dental School, UOP main campus, Stanford, we're partners with them. So when alumni need help with long-term care, they actually come to us. So today's agenda is, so what is long-term care? Who actually pays for it? Long-term care insurance options, tax deduction, state mandated long-term care insurance, and some common beliefs. So I just want to show this picture. So this is my wedding day in 2001. So my mom and dad, my mom was, after this photo was taken, she was diagnosed with stage 3 lung cancer 2 months after our wedding. And then she was gone within 18 months of this photo. And my dad, he had dementia and Parkinson's disease. So I cared for him much longer. And, taking care of anyone is really hard to do for a loved one. And so the reason I have this map is because many people can relate, especially when their children are in college or they're adults, that they don't necessarily live near where they grew up. So if you look at here, it was my sister and I. So I lived here in San Francisco in the Bay Area, and my sister was in Wisconsin. So when it came to my parents' care, it fell on myself and my wife. So that is typically what happens with families, is that if you have multiple children, one child might be close, the others might be in different states. So it generally falls onto the person that is closer to you. So let's talk about what long-term care is. There is a lot of confusion about what long-term care is or what is skilled care, because everyone thinks that, oh, Medicare will pay for everything, which they don't. So just say you had a fall and you're in the hospital. You come home, you'll need some physical therapy or occupational therapy. So any type of professional care is called skilled care. That's what Medicare would pay for. But if you need help just getting dressed, you need help bathing, eating, that is not paid for by Medicare. Basically, it's on you to pay someone or get a family member to help you. So when we think of the daily activities, there's generally six. So bathing, eating, dressing, transferring, getting in and out of a chair, using the restroom, continence. Continence is bowel and bladder control. So those are the main six activities we do, generally without assistance. And the government definition of long-term care is the inability to do two of the six daily activities without assistance. Furthermore, the government defines as someone needing long-term care as either they have a physical disability or they have a cognitive impairment. So it doesn't mean you have to have both. You can either have one or the other, so physical or cognitive. So next, let's go to the levels of long-term care. Generally, when people need long-term care, it begins in the home. So in the United States right now, 75% of long-term care is done in the home. So it means that they're helping you with the daily activities. They might help with daily tasks, cooking, doctor's appointments, some general housekeeping. And generally, when someone needs a higher level of care, they'll go to assisted living. And the assisted living areas like Sunrise or Atria, those places, it's all inclusive. So they'll have living accommodations, they'll have food, and they'll have aides 24 hours a day. So generally, in America, about 10% of the people that need long-term care are in these residential or assisted living facilities. And then here is what we think of when we think of long-term care. We think of the skilled nursing facilities, the nursing homes. So the difference between the residential assisted living and skilled nursing is basically the medical staff. The medical staff is there 24 hours a day. They can actually do a dialysis. They can do, catheters. They can do things like that at the skilled nursing facility, which they cannot do at the residential care facilities. So here, I just want to show how much things actually cost. So Genworth has a really good calculator called the Cost of Care Survey. And here, if you look at today's, so I'm here in Belmont, so I did Belmont, and let's look at how much it would cost monthly. So it's 2023. So right here, let's look at the bottom line, okay? So home health aid. What this is someone comes into your home 8 hours a day, 5 days a week. So this is only 5 days a week and 8 hours a day. This is how much it would cost in today's prices. The assisted living facilities tend to be a little bit cheaper. So right now, the cost of care in the Bay Area, in Belmont Peninsula, is about $6,300. For a nursing home, it's about $14,000. So generally, what happens is because of the cost of inflation, I tell clients that every 10 years, the cost will go up about 50%. So here in 2033, you can see that here it's going up to 10,000, 9,000, and 20,000. But in 20 years is when the prices double. So in 2043, a home health aid will cost almost 14,000, assisted living 12, but the nursing home, you can see that's a staggering amount, almost 27,000 a year for that. Oh, excuse me, sorry, that was 26,000 a month. So let me show you the year. Sorry about that. So these are the annual costs here. I'm sorry about that. Oops. Okay, well, I'll put that calculator in the chat and then you can look at it yourself after. Okay, so next is who needs care and for how long. Generally, when you reach the age of 65, 7 out of 10 people will need care. So for men, they generally need care for about 4 years, for women, about 5. And if you have any of the long-standing either cognitive or physical ailments, if you have dementia, you need care for about 6 years. For Alzheimer's, you need care for about 8 years. If you have Parkinson's disease like my dad had, you're looking at about 11 years of care. So what are the options for long-term care? Jim, I gotta ask you a question. Is my slide showing right or is it not showing right? Jim? Oh, it's showing. Okay. Okay. Sorry, you're on mute. Okay. Sorry about that. But so options for long-term care. So basically, private care is basically you use your family can help you, use your own money, and then there is insurance. And then what about the public options? So the public options, there's Medi-Cal, and then right now they're working on a proposed California State long-term care program, and I'll go into that in detail toward the end. So let's first talk about the public option. And basically, Medi-Cal is the health insurance for disabled or impoverished people. And they do provide some long-term care. Hours are limited. You cannot be in assisted living. And they generally pay for nursing home care. So it is income-based eligibility, meaning that you have to be below a certain income to qualify. And so of all the people in California that are in nursing homes, Medi-Cal pays for about 65% of those people there. So it's quite a lot of money going out to pay for people in nursing homes. So California is proposing a state-run long-term care program called AB 567. So in Washington State, they actually have a mandatory long-term care program, and it's called the Washington's Care Program. That began in 2022, and in July of this year, they start to tax people to pay for this program. So I like to show people this. So your money versus someone else's money. And this is the example. Just say your long-term care expense was $1. And generally people, most of their liquid assets are in retirement money. It's in your 401k, it's in your IRA. But there's a thing called taxes. So if you need to pay for long-term care, you would have to spend $1.40 to get that $1 just because of taxes. Then the next bulk of money that people have is usually with stocks. And with here, because of the capital gains tax, you're having to use about 20% of that just to pay for the tax. If you use cash, of course, cash is one-to-one. So, generally you spend $1, you need $1, you spend $1. But let's look at long-term care insurance. So because the insurance is leveraged, it'll cost you less than a penny to get $1. So your leverage is about 120 times with getting insurance instead of using your own cash. So let's talk about how long-term care insurance policy works. So let's look at this. When you buy a long-term care policy, basically you're buying a bucket of money. And so with this bucket of money, at the beginning, when you buy a policy, they're going to tell you you have a maximum monthly benefit. So that's going to tell you, well, in this instance, the most you can withdraw or you can take out of this bucket is $5,000 a month. Can you take out? Yes, you can take out less, but you cannot take out more. Another thing that they have on long-term care policies is the number of months the benefit would last. So I always get this question, does that mean after 40 months, my policy is no good? I can't use it anymore? It doesn't mean that. What it means is if you took out 5,000 a month out of this, at that rate, it would last 40 months. So basically, it's just a multiplier, but doesn't really affect this, how much you have in your bucket. So the main thing is how much you have in your main bucket and how much you can take out per month. So when you look at options for long-term care insurance, there is an inflation option. Remember I said that the cost of care generally goes up 3 to 5% a year. So this helps keep up with inflation. And here, the elimination period. The elimination period is just like your healthcare deductible. You pay out of pocket until a certain amount of time, and then insurance kicks in. So generally, they use days. So they could do 30 days, 60 days, 90 days. So that is your deductible. So the triggers and types of long-term care insurance. So let's talk about how do you qualify. To qualify, remember we talked about if you can't do 2 of the 6 daily activities, so physical, or you have a cognitive disability, dementia or Alzheimer's. So it's either physical or it is a cognitive impairment. And what does it pay for? It could pay for care at home, it could pay for care at assisted living, nursing home, but you also get with insurance companies a care coordinator. So what does a care coordinator do? What they do is sometimes when a loved one needs help, you don't know where to turn. You might ask friends, you might ask families, Yelp. Sometimes you just don't know where to go. What facility would be best for your loved one. So they actually have a care coordinator. Every carrier has a care coordinator to help you navigate that, whether it's care at home or it's care at facility. They'll help you with that. That's all inclusive with your policy. And generally, how do they pay? So they pay on a reimbursement basis. What that means is that if care was to say 4,000 a month, you would pay 4,000 for the care. Then you would turn in your receipts to the insurance company, and they'll reimburse you. So usually, there's probably maybe 15-day to 30-day lag between when you pay and you get reimbursement. So when we think of long-term care insurance, there's basically 2 camps. So one is the traditional. Traditional is just like your health insurance, is like your home insurance, it's like your car insurance. You have the protection. Rates can go up. You pay as you go, and there's generally a certain amount of benefits you can get. And next, we hear a lot about these hybrids. So the hybrids are basically life insurance married with long-term care insurance. So why would you want to do that? One is that one of the issues historically with traditional long-term care insurance is, well, I pay all this time, I pay all this money, I never use it, my money's gone. So that's where the hybrids come in. The hybrids come in where if you don't need long-term care, that money you put into it then becomes life insurance. So when you pass, the money will go to your heirs or to your kids. So let me give you an example of a traditional long-term care policy. So Tammy bought this policy back in 2003. So remember, this was her bucket. Her bucket was 216,000. And if she took out 6,000 a month, it would last 3 years, 36 months. Her option was she chose the 3% benefit increase. So what that means is that this increases 3% on the anniversary every year. And remember, the 90-day elimination period is the deductible. So fast forward 20 years later, so now this bucket has grown from 260,000 to 390,000. And her benefits, her monthly benefits have changed. So it's gone from 6,000 to 10,830. And here, if she withdrew 10,830 every month of this, then it will last for 36 months. So what's unique about this as well is that even while she's collecting benefits, the inflation is still increasing. So every year, this bucket will increase 3%. And another thing is the premiums, typically when you need long-term care, they waive the premiums. So let's look at the hybrid long-term care. Remember, it's both life insurance and long-term care insurance. And many of the policies are made so it covers two people. So it'll cover two partners or husband and wife. Some policies can do siblings. So let's look at the first scenario. So if you need long-term care, so with the hybrid, remember I said there's life insurance and then there's the long-term care. So you actually have two buckets, the life insurance and the long-term care, which is basically on the insurance's dime, okay? So if you need care, you first draw down your life insurance. If you run out the life insurance, then the company continues to pay. And I have an example in that next slide. So two is, well, if I never need care, what happens? So in this type of policy, it's second to pass life insurance. So husband and wife or partners, they have a life insurance policy. So when both of them are gone, their kids or their heirs, if they never use the care, that money that you put into it would go to their to the kids or to the heirs. Third is, what if they never need coverage? Well, just say after 20 years, I'm tired of paying this. I don't want to pay anymore. I just want my money back. So you can actually get a return of premium based on how long you had your policy, but you can get your money back. So let's show how this hybrid actually works. So this couple has a policy, and the benefit was the life insurance was 200,000, and in this policy they have unlimited long-term care protection. So Sam had a stroke, so he needed long-term care, and so he had to withdraw 6,000 a month. Remember, this was the starting, so 200,000 minus the 6,000 a month. So Sam begins to draw on the life insurance bucket. Remember, that's the first bucket. So after about 3 years, that bucket is gone. So he depletes the life insurance. Well, what happens? What happens is the bucket that basically the infinite bucket that is the insurance company, they continue to pay. So even as he needs care, they continue to pay $6,000 a month. So what about Shannon? So Shannon, 4 years later, she develops dementia. So she needs long-term care. So both of them need long-term care. And with this type of policy, that they're able to get $6,000 a month for the rest of their lives, or until they pass away. So they can never run out of money. Oh, I have a question. So what percent can you get back? So it depends on how long you have the policy. The longer you have the policy, then the more you can get back. If you bought a policy and you canceled after 1 year, they have, and any life insurance, long-term care insurance, they're going to have what's called surrender charges. Surrender charges are, they basically kind of penalize you for not carrying it a long time. So the longer you have it, especially beyond surrender charges, usually last about 10 years to 12 years. It really depends on the company. But generally after that amount of time, you can get close to maybe 80, 90% back. I hope that answered your question, Dr. Lipton. So let's look at unique hybrid premium options. So these options aren't available with traditional, but with the hybrids, they're actually very unique. So one is So sometimes, with clients, they have maybe an old whole life policy or index universal policy. Maybe they bought it when they were newlyweds. They got married, and now their kids are out of the house, so they still have this old life insurance policy, and it had some cash built up into it. So you can do what's called a 1035 exchange. In real estate, they call it 1031 exchange. In life insurance, it's basically the same thing. You can exchange your policies without having to cash out, pay the tax. So you can go like for like there. The other way, another unique way is to move money from an annuity. Sometimes people invest in annuities because they want to keep it for long-term care. And that's a really good plan. But sometimes if you use an annuity and move it to a hybrid long-term care insurance plan, you actually can maybe double the money, because remember, it becomes life insurance. So if you put in X amount, you might have 2 times that as life insurance. And then you'll have unlimited long-term care. The other thing is that I find clients really like is that, most of the people have, relatively, a lot of money saved up in IRAs, SEP IRA, 401k funds. And so you can actually use taxable. So all these, remember, are taxable. You can actually use taxable assets to help pay for your long-term care. So that's a really unique advantage. So the government allows you do that. And, so it's really good for people that are, retired or close to retired. It allows them to gain the leverage for in case they need long-term care. So did you know long-term care premiums are tax deductible? So C Corps benefit the most with long-term care premiums because they can deduct it as a business expense. If you're S Corp, partnership, or individual, the premiums are based on age tiers. And you can actually use HSA accounts to pay for your long-term care premiums. So the government really wants you to have a long-term care plan so you don't have to use, Medi-Cal as your backup plan. So you can see here, so this is per person, and this is, I got this from the IRS website. So these are the premium limits. Every year they change the limits. And so here you can see as you get older, when you hit the 60 mark, you can see that deduction becomes much higher than when you're in your 50s. And when you're 70, you can see that it jumps up there. But C Corps do the best on tax deduction, and everyone else, as Corps partnership individuals, are kind of all on the same boat there. So let's talk about the Washington Care's mandatory long-term care insurance. So the reason I talk about the Washington plan is because they're the first one in the nation to actually enact mandatory long-term care insurance. And California is in talks to do something similar. And so they've had 23 meetings, and they have 5 different scenarios. And they're set to vote on which scenario they're going to present to the committee. They're going to vote on it in the next couple of weeks. So very soon they'll be voting on that. So California, it's hard to say if it's going to be a year or 2 away, but we see it coming very soon. As a group, we're preparing for this coming to California. So let's talk about the Washington Cares Act and what it actually gives you. So with the Washington Cares Act, you have a max amount of long-term care benefit of $36,500. So after looking at our prices here, you can see that isn't very much money. 2 is that how long do you have to pay for it? Well, so they're taxing people that are W-2, which is people that are 1099, they're not taxing them, but they're only tax people in W-2. In California, they hope to capture the W-2 employees as well as the 1099 independent contractors. So with here, there's a 10-year vesting period. So it's 36,500, but remember, you have to pay into it 10 years to get this amount. So if you only paid 1 year, there's no way you would get 36,000. So in terms of how much it would cost, so right now there's no contribution cap, which means that someone making 75,000 gets 36,500. Someone making 400,000 gets 36,500. But the person that is making more will pay more, but get the exact same benefit as someone that makes less. And so how much do they pay? So it's a payroll tax of 0.58% per $100. So what does that mean? So that means for every 100,000, it's about $600. And is there a way to get out of this tax? Well, if you didn't have your own standalone long-term care policy back in 2021 by November, then you're obligated to pay the tax. So let's look at how the Washington Care Programs compares to a traditional long-term care insurance program. So here I have numbers for a person that's 40 years old and in good health. So if this person made $100,000, they would pay almost about 580 in tax, and they would get 36,500. But the thing is that it takes 10 years for them to get that. So at year one, they wouldn't have that. They would probably have 1/10 of that. If that same person took that money and just bought a traditional long-term care insurance, they would actually have 73,000 available to them right after they sign their policy. So right after the policy is enacted, they would have this versus having to wait 10 years just to get this. So I think the program has good intentions, but I think that sometimes the amount of money available is on the light side, as we can see from the numbers. So here I want to show you what the California one is. So it kind of gives you an idea. And so this was from the November meeting. And in this meeting, this is public knowledge. So you can go and Google, California AB 567. And so these are the proposals of how much the tax could potentially be and how much the limit you would have. So there are 5 different tiers. And so one being the bare minimum, and number 5 is being kind of pie in the sky, the best scenario. Okay, so these are the limits. So with the lower one, 36,000. This one, number 2, has 110, but has all these other kind of bells and whistles in it. That's why it makes the limit higher. And you can see here, it goes up to 144,000. So let's look at the contribution. So remember, 60 cents per 100. This is $600 a year for, just say someone makes 100,000, right? Annual wages of 100,000. This is $600 a year. This is over 1,000 a year, 650, 1,600, and 3,000. So basically, what you do is you just multiply this times the 100,000, and that's what you get here. Now, if you're practicing, you have employees, then you have to look at, well, what am I paying as an employer, and what is the employee paying? So they break it out here as well. And so this is all preliminary. They haven't had anything in stone at this point. So if you look for this, you'll see all the documentation there. But I think it gives kind of a good idea of kind of where they're going. So there's 3 common statements I get, and I've been doing this for a while, and I get these all the time. So my spouse or partner will take care of me if I need care. But realistically, if you and your partner are close in age, and if you're 82, you have stairs, and as a male, we tend to get um, sicker earlier than our wives or the ladies. And so, if I weigh 200 pounds and my wife is 120, there's no way she could lift me up, get me in and out of bed, out of a chair. It's just physically hard, especially since we're close in age. And adult children, they don't realize that sometimes that their default, because if you never had that conversation, then your children don't realize that, oh well, um, I guess I'm since I live the closest, I'm gonna be the one to take care of mom and dad. So it's really good to have that conversation, especially if you have kids that live far away. Is it, how's the child that is close gonna feel about having to take on this responsibility? And one of the other common statements I get is, I'm not healthy enough, I'm too old, it's just too late for me. So, each carrier has its own criteria, and some carriers are strict and some are more loose. And so, what I suggest is that um, you have to work with someone that selects the right carrier. Um, people that we've insured people that have diabetes, we've insured people that have cancer, heart attacks. So it's not impossible. Some people are 67, some are 73. I mean, it really depends. We have solutions, but sometimes when you go to, and I'm not trying to bash financial planners, but sometimes they have maybe one carrier. And, one of the typical carriers is, Lincoln Financial. And so, great carrier, but sometimes the criteria to try to get that are, more stringent. So someone might get declined, and after you get declined, then sometimes you're like, oh, forget this, I'm not going to do this anymore. So the other statement I get is, I have enough assets to self-insure, and I would say probably not. People I talk to, I have enough to self-insure. So let's look at this here. So today, if you wanted 500,000 of protection for husband and wife or partners, 500,000 is pretty good. It's a fair amount, but basically you would have to put in 500,000 now, or if you looked at a life insurance policy or a long-term care policy, and you spent 4,000, you can get the same leverage for 500,000 for 4,000 for a couple. So for two people. So what makes more sense? You allocating 500,000 for yourself, or maybe using 4,000. So final takeaways. So long-term care insurance is customizable. Some people want full coverage. Some people just want partial coverage. So it really depends on what you want and what you feel your budget is. So there's some ways to save on a long-term care policy. One is apply to a partner, even if you don't think they qualify. What? That doesn't make sense. It actually does, because carriers, as when you apply as a couple, they'll automatically give you a discount, even if it doesn't work out for one. Inflation protection. Remember, I talked about the inflation protection. That protection is the one of the costliest things of these policies. And so sometimes there's some strategies to maybe not use it or change it, so the premium goes down. And with us, because we have exclusive partnerships with the associations and alumni associations, we're able to offer on traditional long-term care carriers a 5% discount. And then with California's long-term care program, so I think it's going to catch a lot of people by surprise. So if you're thinking that you might want to opt out, look at things earlier than later, because if they implement a deadline like they did in Washington State, then everyone's going to, it's just like there's a fire and everyone's trying to get to the door. That's how it's going to be. It was like that in Washington State. California doesn't necessarily want that to happen because they saw the, how that didn't work out too well there. So I think that they might be a little bit more stealth on rolling this program out. And it takes about 2 to 3 months to apply and to get accepted. So give yourself enough lead time. So are there any questions? Okay, good question, Dr. Lipton. So the average age of people getting protection, the earlier you do it, the better. If you could get protection in your 40s, much better than your 50s or 60s. And it's not only age, it's if you need medication. So in your 30s and 40s, you might be in better health. Then in your 50s, high blood pressure, cholesterol. So all those things kind of add up, which means that it tends to be a higher premium. But because of the potential law coming in, then we're probably going to see a lot more younger people thinking about this. Okay, so the other question is the maximum age they're willing to start coverage. It really depends. There's different ways to cover people that are older age, in late 60s, 70s. First, you're not going to use the same type of long-term care policy for someone that is 40 versus someone that is 70. You're going to have to use a different carrier, use a different strategy. But doesn't mean that if you're older age, you can't get coverage, because we can always find ways. Hope that answers your question. Any other questions? Okay, well, I really appreciate everyone being here this morning. If you have any questions, my contact information is here. Like I said, I'm with Long-Term Care Resources Pacific. We have many carriers that we can draw from. Oh, and so sorry, one more question. If I pay for someone's coverage, can I impact it? Yeah, Dr. Lipton, in terms of someone else's coverage, it depends. It depends who the owner is. If you pay for your son's, just say you pay for a child's coverage, you probably can't deduct it. It has to be the person that owns the policy, which would be like a son or a daughter. Hopefully that answers your question. So if you have any questions, contact me. You can send me email, you can send me a text. I'm here, but as a business partner, there is absolutely no pressure, no sales pressure. I know some people feel that, if I ask you a question, I feel obligated. Absolutely not. So feel free to ask me any questions. Thank you.
Yeah, so thank you again, Mike, for presenting to our members. This is a reminder that the presentation has been recorded. We will post it on our YouTube channel in the coming week. And thank you once more for attending our meeting, and enjoy the rest of your weekend.